How do SNRI medications work to relieve pain? Now, I'm warning you, this is one of the most complicated topics I've addressed on the channel yet. So buckle up and let's tackle it in under 3 minutes. This image is extremely overwhelming, so just follow the tip of my shiny head and it will not guide you astray. We're gonna start right up here with the ascending pain pathway. If you're interested, you can trace how the pathway works here in panel 1, noticing that the key neurotransmitters of ascending pain are not serotonin or norepinephrine yet. This right here is where the pain actually comes into your central nervous system. Nerve endings detect the pain and transmit it into the dorsal horn. From there, ascending projections take the pain all the way up into the cortex itself. Now the brain needs to cope with that pain, which is what it does in this descending arc back down to the dorsal horn. Panel 2 here, I would like to highlight these last two brain regions, the nucleus raphe magnus and the locus coeruleus, which are the source of descending serotonin and norepinephrine respectively. Again, we're talking about the function of SNRIs, so we need to talk about the function of serotonin and norepinephrine separately. Hold here at the tip of my polished cranium a list of serotonin receptors. There's something weird that on this side, these are anti-nociceptive, meaning pain-reducing receptors. These are actually facilitatory in function in states of chronic pain. Captured down here, the net effect is that in healthy states, serotonin is predominantly inhibitory, but in chronic or neuropathic pain, the balance shifts towards facilitation via these serotonin receptor upregulation. Here, and realize that if you want an upregulated receptor to downregulate, you have to stimulate it more. Wouldn't it be helpful if we had some serotonin reuptake inhibition? Now it's time to think back to our recent video on clonidine where we spoke about alpha-2 receptors. Well, here they are again, but now they're inhibiting neurotransmitter release from primary nociceptive afferents. That the alpha-2 receptors here are functioning to inhibit pain signaling via the noradrenergic arm of this system. In schematic is what serotonin and norepinephrine reuptake inhibition are doing to prevent pain. Long story short, unlike an opiate medication, SNRIs do not block pain directly. Rather, they modulate the pain transmission system so that the system can recalibrate into a healthy state in chronic pain. As I said, this is one of the most complex topics we've covered on the channel so far. So I'm putting a text summary down there in the chat. I'm going to put this image in a post separately and share it to my story. If you want to pick the topic of my next video, go ahead and tap this twice, follow my page, and then leave a comment telling me what medication I should cover next. Even more importantly than that, I'm always more excited to learn from you. If you or a loved one have been on an SNRI for pain, please tell us more about your experience. Or if you prescribe SNRIs for pain, please tell us more about how you've seen it work for your patients. As always, I look forward to learning more from you in the comments.